We now have up for consideration S-254. S-254 was read for the first time, referred to the Committee on Natural Resources and Energy, which considered the same and recommended that when the bill is amended, the bill ought to pass. The bill was then referred to the Committee on Finance that also indicated that when the bill is amended, the bill ought to pass. Please listen to the second reading of the bill.
S-254, an act relating to including rechargeable batteries in battery-containing products under the State Battery Stewardship Program.
Now you've heard the second reading of the bill. For the report of the Committee on Natural Resources and Energy, the Senator from Madison County.
Thank you, Mr. President. On the day we voted the bill out, my colleague on the committee from Washington County was ill, and she's the intended reporter of the bill. So if I may, I'd like to pass the baton to the senator from Washington, the junior senator from Washington.
The senator from Addison yields the floor to the senator from Washington.
Thank you, Mr. President. S-254 is a bill that expands Vermont's existing and very successful primary battery stewardship organization to include most batteries, both rechargeable and non-rechargeable, up to 25 pounds, as well as some battery-containing products, which I'll explain further. In case you're not familiar, when the state sets up a stewardship organization, also known as an extended producer responsibility organization, for a particular product, any company that manufactures that product for sale in Vermont is required to join and pay into that organization, which is then financially and physically responsible for the proper disposal of that product. We currently have such a program for something called primary batteries. So what is a primary battery? It's both non-rechargeable and pretty small, only up to 4.4 pounds. We also have a second organization for small rechargeable batteries, but it's voluntary. Under these two programs, Vermont's battery collection sites are required to take back all batteries for free from the public. Between these two programs, Vermont has the highest battery recycling rate in the country and the highest pounds of batteries recycled per capita. So clearly this program is successful in some regards, but not all rechargeable battery manufacturers are required to participate in the voluntary program, which creates inequity among manufacturers, and neither program includes batteries over 4.4 pounds, which might include the kinds of batteries you'd find in, say, an electric lawnmower or a scooter. So the cost of disposing these larger batteries falls on the solid waste management districts, which can cost up to $95 a piece. This is the main issue that S-254 addresses. The stewardship organization, composed mainly of battery manufacturers, will pay for the disposal of a broader spectrum of battery types. It expands the mandatory primary battery stewardship organization to include most rechargeable and non-rechargeable batteries up to 25 pounds. Since this one stewardship organization now encompasses rechargeable batteries, the voluntary rechargeable battery program, stewardship program organization is repealed. I say most there because there are some exceptions, including batteries that are not easily removable from a product or batteries that are in medical devices. It's very important that this mandatory stewardship organization start to apply to rechargeable batteries for a few reasons. There's been a huge increase in the number of rechargeable batteries that we're seeing in collection sites. There are thousands more products with rechargeable batteries in them now than when the primary battery stewardship program was established in 2014. We need a more robust and mandatory stewardship organization to help with education and outreach to the public about how to dispose of them properly. Why does education and outreach matter? As you may have heard, rechargeable batteries are a fire hazard if not disposed of properly. If these batteries are crushed, punctured, or damaged, they can create something called thermal runaway, which is basically short-circuiting, resulting in fires. How common are these fires? Officially, there have been 3 fires in Vermont attributable to rechargeable batteries, but we also heard testimony from one solid waste district that they have rechargeable battery fires as frequently as once a week. Typically, a staff person notices the smoke and puts it out promptly. But once in 2018, a fire started after all the staff had gone home, and the fire ended up causing major damage to the facility. So we need this stewardship organization to help educate the public about free collection sites to keep them out of the regular trash. We need all battery manufacturers to pay into the stewardship organization to pay for their proper disposal. There's another class of products that this stewardship organization applies to, and that's to battery-containing products where there's 3 criteria. 1, the batteries are easily removable. 2, the manufacturer of the batteries included in the product is not otherwise registered with the Battery Stewardship Organization. And 3, the product is not already covered by our electronic waste law. So for example, the batteries on an electric bike are easily removable. The battery manufacturer may not be registered with the stewardship organization already because they don't sell directly to Vermont retailers or to consumers. And electric bikes are not considered electronic waste. Therefore, that electric bike manufacturer would have to join the battery stewardship organization. But we don't want to have batteries doubly covered by the stewardship organization. So battery manufacturers who are registered will provide written certification of their membership to each product manufacturer that uses their batteries, which will let the product manufacturer know that they are off the hook, so to speak. Now that I've explained what this bill does generally, I'll fill in some of the details as I go through the bill. Section 1 expands the definition for primary batteries to include both rechargeable and non-rechargeable batteries up to 25 pounds after January 1st, 2026. The delay is in order to give manufacturers time to register and to be incorporated into the stewardship plan. It also creates a new definition for battery-containing product. It can't be considered electronic waste. It has easily removable batteries, and its batteries are not already covered by participating battery manufacturer. And the name of the program is changed to the Battery Stewardship Program. Section 7582 outlines the mechanics of the program, which have changed very little since it already exists. The collection of batteries must continue to be free to the public. Retailers and municipalities and solid waste management facilities may continue to opt in as collection sites. It has provisions about how to safely deal with damaged or defective lithium batteries over 300 watt hours. The stewardship organization must now provide safety training, and it must provide fair compensation to municipalities and solid waste management facilities that collect batteries. There's still an annual report. ANR still has to approve the plan, and the stewardship organization that the stewardship organization comes up with. The retailer obligation to not sell batteries from unregistered manufacturers doesn't start until 2027, so that they can sell whatever inventory they have in case some manufacturer doesn't sign up properly. Subchapter 3 is deleted because that was the voluntary rechargeable battery stewardship organization, and subchapters 4 and 5 are just conforming language. Section 2 of the bill prohibits the disposal of rechargeable or primary batteries in landfills. Section 3 is an assessment conducted by ANR for the opportunities, challenges, and feasibility for end-of-life disposal of large batteries over 25 pounds or batteries that are not easily removable. These might be batteries found in electric vehicles or power walls, for example. And by batteries that are not easy to remove, that might include batteries in children's toys, where you might have to destroy the toy in order to remove the batteries. My little human had one such toy. These are next level challenges for battery disposal, and there needs to be more work to determine what proper disposal looks like for these batteries or their products. Section 4 outlines the process for implementation, including a timeline. Rechargeable battery producers and battery containing products that qualify must join the stewardship organization by March 1st, 2025. The updated plan must be done by June 1st of 2025, and the rechargeable battery producers have to provide a report to ANR starting in 2027. Section 5 is the effective dates, with everything going into effect on July 1st, 2024, except the retail sale obligation is January 1st, 2026. It's worth noting that this bill requires no increase in staffing or budgetary needs for ANR. And anticipating the question, will this cause battery manufacturers to increase their prices as a result of this stewardship organization? I asked this in committee, and the answer was a very confident no, the reason being that we already have data from the voluntary program that shows that participation has not increased their prices. And more generally, the companies we're talking about are national and international corporations. And in this case, the fact that Vermont is a small market plays to our advantage, because it is not feasible for them to increase prices just in Vermont and would likely result in cost internalization. To recap, this will mean that all manufacturers of batteries or qualifying battery containing products will all be contributing towards the financial obligation of the proper disposal of small and medium-sized batteries. It will mean that less of the cost is borne by our solid waste management districts, More education and outreach will happen around proper disposal of batteries. So ultimately, we should see fewer, not less, batteries in the landfill, and we should see fewer fires at our waste facilities. As an added bonus, when more rechargeable batteries are properly disposed of, the critical minerals in them, like cobalt, lithium, et cetera, can be harvested and recycled, reducing the demand for new mining of these minerals. The committee heard from the Product Stewardship Institute, the Agency of Natural Resources, Chittenden Solid Waste District, Call to Recycle, the Rechargeable Battery Association, Northwest Vermont Solid Waste Management District, Addison County Solid Waste Management. Your Senate Natural Resources and Energy Committee voted to recommend favorably S-254-500 and asked for the support of the Senate. Thank you very much.
Bill was then referred to the Committee on Finance, which considered the same and recommends that when the bill is amended as offered by the Committee on Natural Resources, the bill ought to pass. For the report of the Committee on Finance, Senator from Addison.
President, in section 7594 of the Finance Committee considered the bill, there's a fee in section 7594 of the bill of $15,000 registration for a stewardship organization. Like fees at ANR, generally it is to cover the cost of operating the program. And it is not per, just to note, it's not per manufacturer, it's for a stewardship organization, which may be providing service to many manufacturers. So the committee vote was 7-0.
Question is, shall the bill be amended as offered by the Committee on Natural Resources and Energy? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it. And you have amended the bill as offered by the Committee on Natural Resources and Energy. The question now is, shall the bill be read a third time? Are you ready for that question? Senator from Franklin.
Thank you, Mr. President. May I interrogate the reporter of the bill, please?
The senator from Washington is interrogated as the reporter.
One of the things about stewardship, Mr. President, is that it has a cost somewhere. Does the committee any idea as to whether or not this will affect the cost of batteries and whether or not any such cost will be passed on to consumers?
Thank you, Mr. President. As I mentioned in my report, I did ask about this explicitly in committee, and because there is data already from the voluntary program, the answers that we received was a very confident no, it will not increase prices of batteries because the data that we have shows that it has not increased the prices of batteries for those participating in the voluntary program currently.
Thank you, Mr. President.
The question is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it. You've ordered third reading of S-254. It's my understanding we're going to pass over 285, and we will then move on to take up S-98. S-98 was read for the first time and referred to the Committee on Health and Welfare, which considered the same and recommends that when amended, the bill ought to pass. The bill was then referred to the Committee on Appropriations that also recommends that when amended, the bill ought to pass. Please listen to the second reading of the bill.
S-98, an act relating to Green Mountain Care Board authority over prescription drug costs.
Now you've heard the second reading of the bill. For the report of the Committee on Health and Welfare, the senator from Chittenden Southeast.
Thank you, Mr. President. Vermont has a long history in working toward lower drug prices, and this bill is another attempt to regulate our prescription drug costs for citizens in the state. In the 2017-2018 session, we passed a law that would allow for, we were the first in the nation to pass a law that would allow for Vermont to appeal to the Health and Human Services Agency for importation of drugs from Canada. And then in that same session, we also passed a transparency law that has an oversight of those drugs that are prescription drugs that are too costly or their cost increases radically within a short period of time, and the Attorney General looks at those cost increases. I handed out a sheet that I'm not going to talk about, but I wanted to demonstrate to you some of the complexity involved in the determination of prescription drug costs for the consumer. It's not just, it's complex, and it's not just complex for us, it's also complex for insurance companies, it's complex for retail pharmacists and others. So what this bill will do is it will look at, that we will look at, as we continue to look at high costs. We know that between 2017 and 2021, drugs for chronic conditions escalated in cost to $198,000 a year. Cancer drugs went up 55% to $283,000 a year. And then overall cancer and other drugs, rare disease drugs, had a median price of $257,000 a year. That seems like an overwhelming amount of money for anyone to foot the bill for, and that includes our state funded prescription drug programs. So, Mr. President, in 2020, we've worked with NASHP, the National Association of State Health Policies, in the past when we looked at importation. And one of the things that we've learned recently is that we in this country overspend on drugs prescription drugs where other countries do not. For example, as compared with, we'll start with Canada because that's the lowest. We pay 118% of what Canadians pay for their prescription drugs. We pay 155% of what the UK folks pay. We pay 125% of what Germany pays, 158% of what France pays, and 679% of what the costs are in the country of Turkey. Canada's right next door, and we still pay more than Canadians. So it's important for us to understand what we can do to reduce prescription drug costs. It will reduce the cost of our insurance premiums. We know that there's huge pressure on insurance premiums, and those insurance premiums then escalate the costs associated with teacher contracts when those are negotiated. So overall, what we're trying to get at with this bill is a way to regulate the upper price limit for prescription drugs that are utilized in the state of Vermont. There are other states that are also looking at a prescription drug advisory board. There are 10 other states. They include Colorado, Maryland, Minnesota, Washington, Maine, New Hampshire. And they are all looking to establish upper price limits for prescription drugs to reduce the cost to us, to citizens of the state, and to our insurance companies. So I'll go through the bill very briefly. S98 would require the Green Mountain Care Board, in consultation with its own technical advisory groups and other state agencies, to explore and create a framework and methodology for implementing a program to regulate the cost of prescription drugs for Vermont consumers and Vermont's healthcare system. The bill will create 2 permanent classified positions at the Green Mountain Care Board to lead the exploration, development, and implementation of the prescription drug regulation program. And it will appropriate $495,000 to the Green Mountain Care Board from the Evidence-Based Education and Advertising Fund in 2025 for the following purposes: $245,000 to the fund for positions created in the bill. One is a director of prescription drug pricing, and one is a policy analyst for prescription drug pricing. And $250,000 to contract with experts on prescription drug related issues. Finally, the bill would amend the statute to include the Green Mountain Care Board's prescription drug cost regulation initiatives as an allowable use of funds from the Evidence-Based Education and Advertising Fund, which is described in Section 2 of the bill. So as the Green Mountain Care Board begins its exploration for a framework and a methodologies for regulating prescription drugs, there are some there's some guidance given on page 2 of the bill I don't know what page it is on in the calendar. So.
The
and
bill
so-
can be found on page 1502, so maybe the second page of the amendment is
Thank you, Mr.
1503.
President. So in section 1, there's a list of those things that the new group would consider when looking to develop a negotiation program. We'll look at what Medicare is doing, look at what other states are doing, and then use expertise to understand what are the possibilities for establishing upper price limits for some of the drugs that we use more frequently in the state and that are most costly to citizens of the state. I will say that Medicare is already working in this area. And in August, Medicare will have identified 48 prescription drugs, list those drugs, and then limit price hikes for those drugs in Part B, to limit the price hikes to the CPI, the Consumer Price Index. And without that, then there will be a penalty to be paid by the companies that have increased prices. So Medicare is beginning that process, and this will be a place that perhaps the new Prescription Drug Advisory Board at the Green Mountain Care Board can begin its work and at least understand if some of those regulations are possible. Mr. President, we heard from a long list of folks, including our Joint Fiscal Office, Ledge Council, Green Mountain Care Board, Office of Health Advocate, DFR, Department of Financial Regulation, the Director of the Pharmaceutical Research Manufacturers of America, Vermont Association of Chain Drug Stores, the Healthcare Advocate, Director of the Rutland Pharmacy, Health Policy Analyst, individual who has previously worked with NASHB, Public Policy Attorney and General Practitioner from the Rutland, Vermont and the Vermont Pharmacists Association, from the Vermont NEA, from Associate Scientist from Johns Hopkins Bloomberg School of Public Health, from the Vermont Health Initiative, and from Vermont Healthcare Distribution Alliance, and from Biotech Innovation Organization. So, Mr. President, the bill passed out of committee 3-2, and we ask for the support of the Senate to move it along. Thank you, Mr. President.
Bill was then referred to Committee on Appropriations, which considered the same for the report of the Committee on Appropriations, says Senator from Chittenden Southeast.
Thank you, Mr. President. As the Committee on Appropriations looked at the manufacturers, what's known as the manufacturer's fee, and evidence-based education and advertising fund for prescription drugs, and felt that the fund currently has substantial revenue in it, and has a surplus that could be used for this purpose. And so your appropriation committee voted it out favorably, and the vote was 6-1-0-1 or
601,
you,
according
Mr.
to the
Chair.
calendar.
all right, thank you.
So the question now is, shall the report of the Committee on Health and Welfare be amended as offered by the Committee on Appropriations? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have amended the report of the Committee on Health and Welfare as offered by the Committee on Appropriations. The question now is, shall the bill be amended as offered by the Committee on Health and Welfare as amended? Are you ready for the question? Senator from Rutland.
Thank you, Mr. President. May I inquire the reporter of the main bill?
The senator from Chittenden Southeast is interrogated as a reporter.
Thank you, Mr. President. I believe on the witness list, the reporter mentioned Rutland Pharmacy, and I'm wondering whether the reporter could characterize the amount of support that that witness gave for the bill.
Yes, Mr. President, that was Jeff Hochberg, and he was very supportive of the bill. As it was introduced, he was supportive of the bill, wanting some changes to ensure that the supply chain benefits for small retailers in the state would continue. So once upper price limits are established within a supply chain, then you might see some reduction of margin for some of these organizations. But as we went through the bill, we changed the language, and one of the considerations that will be given as the process goes forward at the Green Mountain Care Board will be to ensure that supply chain folks are supported. That will be one of our goals.
I thank the senator. Thank you, Mr. President.
Senator from Caledonia.
Thank you, Mr. President. I would just like to comment, because generally the Appropriations Committee strips out appropriations. So people are saying, why did we let this go in the way that we did? And first of all, the manufacturer's fee is a very limited in terms of the purposes that it can be used for. And so it was because of the restricted nature of that particular funding source and how it could be utilized that the Appropriations Committee allowed this bill to move forward with the appropriation intact, because it is not an appropriation that would be having to be prioritized against all the other requests that have been included in the many bills that we have considered to date, and we will have more to consider. I just wanted to bring that up because I'm sure people might be wondering, are we being inconsistent? But in this case, it was done for those reasons. Thank you.
So I believe the question is, shall the bill be amended as offered by the Committee on Health and Welfare as amended? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it. You have amended the bill as offered by the Committee on Health and Welfare as amended. The question now is, shall the bill be read a third time? Senator from Madison.
Thank you, Mr. President. I know it's been a weird morning where we've be coming in and out. So I just want to say a couple words about this, because we get asked all the time what we're doing about the price of healthcare. And one of the main drivers of that cost of healthcare is prescription drugs. It's one of the main things that's making healthcare costs increase exponentially. And we're seeing that in budgets and issues across the state, including our school budgets. So this bill, as it started in our committee, would have done a lot more and implemented a plan right away to have an drug affordability program. Unfortunately, we couldn't move at quite that quickly. We got a lot of testimony that said the Green Mountain Care Board needs time to figure out the logistics, to figure out the process, to learn from other states, to learn from the federal government. So we are taking baby steps in this bill, which frustrated me because I tend to want things to move a little bit more quickly. But I want to assure you that this is taking good steps in the right direction to limit the cost of healthcare, especially obviously prescription drugs. There was a lot of conversation in our committee about return on investment and whether or not the money that we are spending on this program would save Vermonters money in the future. Would what we're investing help our state in the long run? And the answer is yes. It will, because the program is meant to look at affordability of prescription drugs specifically for Vermonters. So I know that sometimes we get a little lulled on the floor and we don't realize what all the implications of a bill but we're passing. But this is one you can tell your constituents we passed in order to help with the cost of healthcare. And over the next several years, we will hopefully start to see the return on that investment once this program is set up. Thank you, Mr. President.
Senator from Chittenden Southeast.
Thank you, Mr. President. I want to thank the senator from Addison for her comments. I deliberately attenuated this report because I was told on Friday that perhaps my report that day was too long. But I will add, and I will add this, that in 2017, when I presented to the NASH meeting in Florida, I read from a report about drugs and the choices that people are making. 38% of the respondents are spending less on entertainment and dining out. 31% are spending less on groceries so they can buy their drugs, their prescription drugs. 25% use their credit cards more often and have gone into debt as a result of prescription drug costs. They spent less on their family, 25%. 19% postponed paying other bills. And 10% postponed retirement to maintain their health insurance. There are choices that people are making today because of the cost of drugs that they are taking to keep themselves alive. And the whole point of this is that right now, the pharmaceutical industry has unfettered opportunity to raise costs for the drugs that we need. So what this is doing is what the state can do. First, the state needs to go back and look at our opportunity to buy drugs, prescription drugs from Canada. That hasn't happened yet. It should. Florida did it ahead of us. Florida worked with us after we passed the bill. Secondly, we need to increase transparency of what this all means, that little chart I gave to you. We need to lower these costs. Right now, the cost of prescription drugs is 23% of the total healthcare costs. That's more than in-hospital costs. Think of that. Think of that. So, Mr. President, I want to say, let's move forward with this bill. It's a first step. We will have to come back. We will have to expand. The Green Mountain Care Board is enthusiastic at this point. We want to keep it that way, and we'd like to move forward so we can reduce the overall cost for our health care, beginning with one of the highest pressures, and that is a prescription drug cost. So thank you, Mr. President.
Question is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay.
No.
The ayes appear to have it. The ayes do have it, and you've ordered third reading of S 98. We now have up for consideration S 114. S 114 is read for the first time, referred to the Committee on Health and Welfare, which considered the same and recommended that when the bill is amended, the bill ought to pass. The bill is then referred to the Committee on Appropriations, which also recommended that when the bill is amended, the bill ought to pass. Please listen to the second reading of the bill.
S 114, an act relating to removal of criminal penalties for possessing, dispensing, or selling psilocybin and establishment of the Psychedelic Therapy Advisory Working Group.
Now you've heard the second reading of the bill for the report of the Committee on Health and Welfare, the senator from Chittenden Central.
Mr. President, S 114 is a bill that will establish a psychedelic therapy advisory working group. So I'll start at the end of the bill, which states that if passed, the title of the bill will change immediately to an act relating to the establishment of the Psychedelic Therapy Advisory Working Group. So this bill focuses exclusively on the health implications of psychedelic therapy and does not attempt to weigh in on the decriminalization of psychedelics. I just wanted to make that clear. When faced with a problem, you have the choice to do what you've always done or to try something different. In this case, we have a crisis of mental health. And we can do what we've always done. Therapy, pharmaceuticals, mindfulness practices have all been proven to help. However, at this time, they don't seem to be meeting the needs of all of those who are suffering day in and day out with trauma, PTSD, anxiety, and depression. Many would argue that these particular substances never should have been designated as Class 1 drugs to begin with, because their power to heal far outweighs their ability to harm, especially when taken therapeutically with a doctor or healthcare practitioner. This bill will start the state of Vermont on a journey to explore other possibilities, other options to treating mental illness. Mr. President, may I share a quote, please, from Kurt White, who is the Vice President of Outpatient Programs and Community Initiatives at the Brattleboro Retreat?
Without objection, you may.
He says, psychedelic psychotherapies have the greatest transformational, actually it's transformative, potential. the mental health field has seen in many, many decades. He says, I believe it will be a great leap forward in the field, not a panacea, but a once-in-a-generation leap. They have the immediate and available potential to help individuals with some of the most complex mental health conditions that exist: depression, trauma-related symptoms, substance use disorder, cigarette smoking. We have an opportunity as a state to do this right, to make a difference here, and with science and experts guiding us. While no substance is without some risk, the overall risks of psilocybin is considered by experts to be very low, significantly lower than many commonly used and legal substances. The risk of addiction and compulsive use is also very low. As a substance, it works very differently than those that affect the dopamine pathways in the brain. So if you look at the bill, which is on page 1505 of the calendar, you will see that section 1 of the bill names the Therapy Advisory Working Group and Study. Subsection A creates the group. Subsection B outlines its membership. And I won't necessarily read you all of the people who will be on the group, but we heard from many of them in committee. Subsection C defines the powers and the duties of the group. Subsection D calls out the Vermont Psychological Association as the provider of assistance with scheduling and staffing meetings and developing and submitting the report. Subsection E details to whom the report shall be submitted and the date. Subsection F outlines the meetings, and G is the per diem compensation and reimbursement, and section 2 is the effective date. Some of our witnesses that I'd like to mention: Dr. Rick Barnett, who is the founder and the legislative committee chair of the Psychedelic Society of Vermont and the Vermont Psychological Association. Dr. Charles McLean, who is the Associate Dean of Primary Care at the University of Vermont. Dr. Catherine McLean, who's a former Johns Hopkins research, and Kurt White, who I mentioned earlier, Vice President of Outpatient Programs and Community Initiatives at the Brattleboro Retreat. We voted 3-2-0 on this bill, and we asked that the body concur. Thank you.
The bill was then referred to the Committee on Appropriations, which considered the same, and for the report of the Committee on Appropriations, the Senator from Chittenden Southeast.
Thank you, Mr. President. We reviewed the section of the bill on the working group, which could possibly have financial implications, fiscal implications, and agreed that it would be de minimis, if at all. So the committee voted 6-0-1 to support the bill as written. Thank you.
So the question is, shall the bill be amended as offered by the Committee on Health and Welfare? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes appear to have it. The ayes do have it, and you have amended the bill as offered by the Committee on Health and Welfare. The question now is, shall the bill be read a third time? Are you ready for the question? Senator from Madison.
I want to thank the committee and the senator from Chittenden Central for the report on the bill. There has been a great deal of work over decades establishing the validity of psilocybin as a natural medicine that can be effective in treatments, as the reporter noted. And I appreciate, although I wish we were able to take more steps, there are complications, and so I appreciate that we are going to set Vermont up to be more responsive to an opportunity for many Vermonters to receive safe and effective treatment using a natural medicine. Most of the pharmacy that we've had in the United States for a long period of time was originally plant-based. So it's a reminder that there are many plants that are the source of medications we count on a daily basis, even if we don't know their natural source.
Question is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please indicate by saying aye. Aye. Those opposed indicate by saying nay. The ayes appear to have it. The ayes do have it, and you've ordered third reading of S-114. We have now up for consideration S-120. S-120 was read for the first time, referred to Committee on Education, which considered the same and recommends that when amended, the bill ought to pass. The bill is then referred to the Committee on Appropriations, which considered the same and also recommended that when amended, the bill ought to pass. Please listen to the second reading of the bill.
S-120, an act relating to post-secondary schools and sexual misconduct protections.
I have heard the second reading of the bill. For the report of the Committee on Education, the Senator from Wyndham.
Mr. President, this bill is located at the bottom of page 1507 of today's calendar. S-120 is a bill that creates a statewide standard that would strengthen sexual misconduct protections for students in all of our colleges and universities. And while I'm sure there's mounds of data and statistics that could be discussed in regards to this topic, there are just two Vermont-specific data points I want to share before I move forward. According to the Vermont Center for Crime Victim Services, women between the ages of 18 and 24 are 4 times more likely to be sexually assaulted compared to women in other age ranges. Additionally, 1 out of 6 women will experience a sexual assault compared to 1 out of 33 men. This bill spent a long time in the works. It was introduced last year, and when we first started taking testimony, there were a fair number of disagreements as to how parts of the bill were worded. Over the summer, the Intercollegiate Sexual Harm Prevention Council, in collaboration with various stakeholders, including students, state universities and colleges, independent or private colleges, made significant progress on the language to get where we are today. And as we started the session, there were a few lingering questions that we were able to resolve, and this work represents a consensus between all of the stakeholders. So Section 1 requires that post-secondary schools ensure that students have access to confidential sexual misconduct support services covered by the Crisis Worker Confidentiality Privilege. You'll see in Section 1 that this refers to applicable law regarding confidentiality, and that applicable law is located in Title 12 VSA Section 1614. If an external provider is providing confidential support services for a post-secondary school beyond what it would provide as a matter of course to the general public, the post-secondary school is required to maintain an independently negotiated agreement with that external provider. This requirement will help ensure that the school is able to continuously and consistently provide these services to students. Section 2 is related to amnesty protections. This section requires post-secondary schools to create and adopt an amnesty policy that prohibits disciplinary action against a student reporting or otherwise participating in a school's sexual misconduct resolution process for alleged policy violations related to the sexual misconduct incident at issue. So for example, if a student was underage and drinking at a party and they were also sexually assaulted, they cannot be disciplined for the policy violations of drinking underage. These provisions are intended to ensure that fear of misconduct sanctions don't prevent a victim from coming forward to report their assault. The section does allow a school to take disciplinary action if it determines that the conduct at issue placed or threatened to place the health and safety of another person at risk. Section 3 refers to the annual awareness programming and training, which requires post-secondary schools to offer annual trauma-informed, inclusive, and culturally relevant sexual misconduct primary prevention and awareness programming to all students, staff, and faculty. I have a list of that training if anyone is curious, and I can provide further details if anyone's interested. This section also requires post-secondary schools to collaborate with community partners to include information about each community partner's role and offerings in primary prevention and awareness trainings. Section 4 repeals the July 1st, 2025 sunset of Intercollegiate Sexual Harm Prevention Council. Section 5 redesignates Section 2187, the Intercollegiate Sexual Harm Prevention Council, to Section 183. Currently, the council enabling language lives in the state colleges chapter in Title 16. And since the council and the rest of the statute added by this bill apply to all post-secondary schools, not just the state colleges, this section redesignates the council statute to the post-secondary schools subchapter, along with all the other statutes added by this bill. And I just want to close by sharing a few final thoughts on this bill. First, and most importantly, it goes without saying that anything we can do to reduce and ideally eliminate instances of sexual misconduct is a top priority. This includes both holding people accountable when they commit these acts, while also making sure we provide support to victims. And second, this sends a strong message to both current and prospective students that leaders in this state, both the legislature and various stakeholders from our schools, take this issue seriously and will continue to do so. Young adults who are going to go to school here or are interested in moving here to pursue their education deserve to not only feel safe and have the resources available to address sexual misconduct, but they also deserve to know loud and clear that we care about this issue and we're taking steps to address sexual misconduct on our campuses. We heard from the following witnesses: the Attorney General's office, the Vice President of Public Affairs from Planned Parenthood of Northern New England, the Co-Director of the Vermont Network, the Federal and State Relations and Legislative Liaison from the University of Vermont, the Director of External and Government Affairs from the Vermont State Colleges, the Title IX Coordinator from UVM, a higher education consultant, a student from UVM, Assistant General Counsel from UVM, the Deputy Director from the network, the Associate General Counsel and System Investigator from the Vermont State Colleges, the Assistant Vice President of Diversity, Equity, and Inclusion from Norwich University, Legislative Counsel, the Strategic Advisor from the Association of Vermont Independent Colleges, and the Director of External and Governmental Affairs from the Vermont State Colleges System. The vote was 5-0-0, and I ask for the Senate's support.
The bill is then referred to Committee on Appropriations, which considers the same and recommends that when further amended, the bill ought to pass. Please for the report of Senator of Appropriations, Senator from Chittenden Central.
Thank you, Mr. President. Our actions on this will seem very familiar. Section 6, the appropriation section, has been deleted. That's a $22,000 appropriation that would go to crime victim services to be passed on to this task force. That is not a decision not to fund it. It's a decision to defer that decision on appropriation until the end of the process when we have all of the requests to judge between. So no prejudice against the policy. And I will say on a personal level, I was on the original study committee that produced this task force, and I'm delighted to see it going forward. So with that said, Mr. President, our committee vote was 7-0-0 in appropriations.
So the question is, shall the report of the Committee on Education be amended as offered by the Committee on Appropriations? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it. You have amended the report of the Committee on Education as offered by the Committee on Appropriations. The question now is, shall the bill be amended as offered by the Committee on Education as amended? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have amended the bill as offered by the Committee on Education as amended. The question now is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have ordered third reading of S-120. We now have up for Senator from Chittenden Central.
Thank you, Mr. President. I appreciate the Senate reconvening after the General Assembly, but I believe that's enough for our work for today. Folks need a little time before their afternoon committees. So with that said, pending announcements, I would move that the Senate stand in adjournment until 1 p.m. Wednesday, March 27th.
Are there any announcements? Senator from Addison.
Senate Natural Resources and Energy will meet tomorrow morning at 9 a.m.
Senator from Bennington.
Thank you, Mr. President. Senate Education will meet at 1:15.
Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 1:30.
Any further? Senator from Addison.
Senate Government Operations will meet at 1:30.
Senator from Caledonia.
Senate Appropriations will meet at 1. If you look at our blackboard, you will see that we have a very heavy presentation list of departments for their 25 budget requests. So 1 o'clock. Thank you.
Senator from Essex.
Thank you, Mr. President. Senate Institutions will meet at 1:15 today.
Senator from Windsor.
I don't think anyone in the chamber will be unhappy with my announcement The Senate Democratic Caucus will not meet today. However, we are sharing all the delicious snacks that we were going to be presenting are in the cloakroom if people would like to take advantage. So thank you. We will meet next Tuesday at 12:15.
Are there any further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate stand adjourned until Wednesday, March 27th at 1 PM. Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and the Senate will stand adjourned until Wednesday, March 27th at 1 PM.